So I don't know what to talk about. Like I feel general pessimism, like a pessimism against the world, and I just sit here. I had my kids for a few hours tonight again, and it was awesome as usual. But I mean, again, like the whole ride home, just straight faced. Like I couldn't even laugh at myself. Couldn't even think of things to laugh about. It was just terrible. Probably looked like my, how do you say it? My affect was flat. But then I get on the mic and it's kind of a good distraction. I guess it's talking therapy, right? And that actually, I think they've shown that to help with depression. I mean, that's what going to a therapist is. Like that's what these sessions are for. It's to help me get through this naturally because I can't afford drugs. I can't afford to see a doctor. I don't have health insurance. I can't afford health insurance, even if I get offered health insurance. So, gotta do what I've gotta do, right? And I can't even afford food. So I don't know how. Of course, I could always drop the alcohol, and I was off for a week. That was good. And then I'm back on. I'm keeping my heat off right now. It's supposed to get down to like, I don't know, 15 tonight. Tomorrow night it's 10, maybe a little lower. Maybe it's like 8. I don't know. My heater can't keep up with that anyways. When it gets down to 8, I have to turn it on high, and it stays probably in the 40s in my cabin here. My cabin, not my cabin, my trailer. But with enough blankets, it gets warm. I mean, I've got like 40 blankets, so it's not like I'm gonna die, but I mean, my kids, if they come and stay with me, I have to fill up the propane tanks, but sometimes I can't afford that. I mean, I do. Not that I can't afford it, I just go put it on a credit card, which I can't afford to pay. So, I mean, I do, I don't know. I make payments on them, but it's just not enough. I mean, I'm grateful to have credit cards. They're letting me still do these things, but I'm not making enough to offset my expenses. And I don't buy anything. I don't have a desire to buy anything either right now because I'm depressed, but pretty bad. But I feel like I've gone through everything. One thing I didn't talk about was overspending. When I first got divorced, I kind of went nothing too big. I'm talking like maybe a couple $1,000s, but I kind of overspent. I bought a few things like I don't know, like a TV and stuff like that, and I just put on a credit card, like a non-interest thing. And those are just about paid off, but I don't know. So I went through that phase. I knew before I went into it that it wasn't gonna fill anything. And I played video games for a couple months, and then things kind of just went blank, with nursing school. But nursing school was such a big distraction, and it forced me to succeed there because of my kids. Big motivator. It was so hard, and I worked so much. I worked like over 110 hours a week. So, like, that was a big motivator for me, and it kind of distracted me from this. But once I became a nurse, the depression is just setting in so heavily. Like, I'm busy, but I'm not as busy anymore. I can actually sleep more. And it's, my mind's settling down to its regular level. And that's why I've been clinically depressed for the last 6 months plus. I'm sure I was before. I'm just had enough distractions where I wasn't feeling some of the symptoms. But as soon as those distractions went away, man, I just plummeted. But I've talked about this. I mean, with an ADHD mind, it's a really similar to someone with depression. In fact, they use depressants for ADHD as a form of therapy, and they can be effective. I mean, sometimes you'll eat more on some of them, and as a nurse, I know this. I've got brothers that have this has happened to. And they say that you might lose your appetite with a stimulant. I just never found that. It's more of a compulsion for me. So like I said, the problem with the stimulants is, like, yes, I can focus, but I feel like I focus on my ADHD issues just more effectively, more efficiently. So I have anxiety more efficiently when I'm on Adderall. I don't know. I have my depression more regularly, right? With the doses, you put the stimulant in, and then when you start coming down off the stimulant, you start feeling the throes, and that's why I got rid of it altogether. I feel like I'll do better adjusting just to low and just make that my norm than to try and keep that high. It's just been a hard adjustment. My body doesn't like it. I still compulsively eat, which I don't like. But I've been doing better about buying food, so I've been making some improvements. I actually went to the store and bought ramen today. It's only 72 cents for, those big ones, the little bowls. I can throw it away. I don't have to do dishes, so that's less thing I have to worry about. I bought good food before this, but it's all the same, whether it's ramen or I'll overeat healthy food too, so it doesn't matter, right? Doesn't matter. Getting fatter. There's no stopping it. So, hopefully my body will round out. Hopefully my body will stop at some point. At least for a while, until my metabolism starts slowing down with age. But we'll see. But my kids were fun. I felt kind of on edge a little bit. I felt bad. I felt like I got upset, or I've been getting upset this last month and a half a little more snappy with them. Although that's been the case, I think, since the divorce. And it's hard. I try to hold up to what their mom wants me to do with them, or not do with them, to try and keep it regular, so it's not just party, which is a lot easier for me, but I'm trying to actually parent too, because I can tell my 3-year-old wants that. He wants to be parented. He asks to be parented. He's such a little demon child, but he does it purposefully because it seems like he doesn't like the negative attention that I give him when he gets in trouble, but he likes it. His body likes it. You can tell, and he whimpers like a little kitten, but it's like a fake whimper. But when I get upset with him and I'm pretty stark with him, he starts going, It's so cute, and I've got to keep a straight face, and I try not to laugh. I try not to cry, and I miss that I don't have more time with him, because I know he misses that. Man, I hope their mom is trying to get out there and date. I hope she's just too busy to not be depressed, and she's just has a strong desire to fill that void for them, for a father. I hope so much for them, for their sake. Mikey just needs that attention from a guy, but Ezra wasn't able to handle us being together. It was so detrimental to them during the end there, the last couple years. I hope I didn't affect his development being in that marriage forever. I really don't. I just want her to get remarried to a good guy. Much, much better than me.